According to Life's Clinic's findings, hospital admissions dropped to 3,004 patients during the fifth wave when the BA.4 and BA.5 Omicron subvariants were prevalent. The mortality rate for COVID-19 patients at Life Healthcare hospitals was 80% lower during the Omicron wave. Earlier, I spoke to Dr Louis, who's a healthcare practitioner specialising as an oncologist. Dr. Louis Kathan. Dr. Louis Kathan, thank you very much indeed for joining us. Welcome to the program.
Good evening, Peter, and good evening, viewers, and thank you very much for inviting me.
So the fifth wave has come and gone. I just wonder, from what you've been observing from where you are and the healthcare facilities that you're functioning in, what have been your observations by and large in terms of how we were affected by the fifth wave?
So, Peter, the fifth wave was mainly due to the Omicron subvariants BA.4 and BA.5. It peaked between April and June 2022. During the fifth wave, when one compares that to the third wave in the Delta variant, we at Life Healthcare observed that there was a decreased number of hospital admissions. That was the first thing. There was a decrease in use of ICUs and a decrease in ventilator usage. We also saw a decrease in the number of patients who passed away in hospital.
How do we explain that largely? What was different this time?
From the Life Healthcare data, we assume that our fifth wave was different from the prior waves because firstly, we understood the disease slightly better. Our management techniques and the choice of drugs had improved. We also think that vaccination played a big part, people being vaccinated and more people being eligible for vaccinations and boosters.
All right, but this Omicron variant, whilst perhaps the consequences were less severe, it was as active in terms of its ability to spread, I'm guessing.
It was active, and in some studies, they're saying that it is actually more infectious than prior variants were.
All right, going forward, what does this mean for us? I mean, you know, we walk around now, there are no masks, and yet we hear stories of people in America dying at a rate of 400 a day. We saw Shanghai shutting down earlier this year, and we see Japan recording 100,000 cases a day. What does all of what we see abroad mean for us here?
Well, COVID remains a global health challenge, so COVID-19. We have to be vigilant. We have to maintain our hand hygiene and sanitization. We have to continue with vaccination if eligible, and also booster shots. We do have to also be aware that, you know, there's a difference between northern and southern hemisphere as far as winter and summer goes, so temperature effects. Also based on innate immunity and based on vaccination practices. So we as South African doctors and physicians, we take the guidance of experts, we remain vigilant, we do monitor our trends, and we are cognizant of what happens elsewhere in the world. I would, however, like to say to South Africans, don't fear, we need to be vigilant, and we need to see what actually happens going forward. But basic health practice and sanitization, vaccination regimes, that's the mainstay of our management at this point.
I just wonder, the fifth wave, we're able to look back a little bit. Were there any particular groups, I don't know, gender, age groups that were more vulnerable to the Omicron variant?
So in the Life Healthcare data, which we've been analyzing intensely over the past COVID waves, we noticed that if one compares the fifth wave to the third wave, we had a decrease in the hospitalizations in Life Healthcare of 84%. We had a decrease in the mortality rate of up to 80%. If one looks at the length of hospital stay amongst patients, so patients who were severely ill, there was a decrease in their length of stay by 22%. And in milder cases, the decrease in hospital stay was 38%. More importantly, there was a decrease in ICU usage of 92% and ventilator usage of 97%. When it comes to comorbidities, we do advise these patients to be vigilant. However, there was a decrease in the mortality amongst people with comorbidities, specifically hypertension, cardiac disease, pulmonary disease. Their mortality rates did decrease, but not as much as our patients who have had renal problems and diabetes.
What's your best advice going forward? I mean, I'm still a little bit nervous, so I still wear a mask when I go out, and I still sanitize my hands when I'm going into a shop and that kind of thing. But I'm starting to look a bit odd because everybody else has dropped these habits. What are your thoughts and what's your advice in terms of how we should be handling this post-fifth wave period?
Peter, it's a very difficult question to answer. It's based on what our risk factors are, our comorbidities. In other words, are we on chemotherapy? Are we a renal dialysis patient? What age are we? So, normal common sense, I would say, if one's out generally in the general public, if you're out in a big open space walking in the field, I'd feel very comfortable walking without a mask. If one sits on an aircraft, as an example, I would wear a mask, and that's my personal advice. But I would, utilize my risk factors, an understanding of risk factors, and my own personal circumstances to make that decision. We do see most malls and most people walking around without masks, and most of them are healthy and well, and that's a good practice for them. But hand sanitization, hand hygiene, vaccination where appropriate, and booster shots is what we are advocating at this point.
And what sort of levels are you seeing now? Are you still seeing admissions? Are you still seeing, sadly, fatalities as well? So COVID, as I said previously, is still with us. The cases that we are seeing are much milder, comparable to the fifth wave. And with everything, with all sorts of infections, people are going to pass away, but those numbers are dramatically decreased from before. And then the variant B.5, I just wonder, is that becoming more and more prevalent, or much the same as it was with B.4, with this B.5?
Peter, during our fifth wave in South Africa, BA.4 and BA.5 were the most common variants, and those were the predominant ones, and we are still seeing them present.
All right. So is there any fear? I mean, we're in the middle of winter, and there was the fear that this was going to be the worst time. I think we're quite through a bit of winter. I suppose one never knows, but are you optimistic that we're unlikely to see a major wave again in the near future?
We remain vigilant. We constantly monitor. We monitor our admissions on a daily basis, and we are optimistic. What we are saying is continue vaccination, continue hand hygiene, continue to manage your comorbidities, modify your risk factors, and consult with your healthcare practitioners to give you the best advice.
And then in terms of vaccinations, I've had a booster shot. It's been a while now. Will we need to get another booster maybe in 12 months, or what is the practice at this stage? Once you've had your booster, is that it until further notice?
So there are constant guideline updates. It's based on your age, based on your comorbidities, so in other words, which diseases you have, and that constantly gets updated. We do envisage that boosters will be a way of life and a way of the future. That's the current thought, and that is always subject to change. But we do advocate, if you are in the population group that benefits from boosters and The circulars are available on the internet, and healthcare practitioners can inform you if you're a candidate. You should take up your vaccinations and your boosters.
All right. So in summary, I guess the story has been generally positive in that we're not getting as sick as we did before, and that vaccinations and innate immunity has contributed greatly to the situation that we're in now. But we must remain cautious and vigilant.
We must remain vigilant. The other big development was initially we did not know how to manage COVID-19 effectively, but our knowledge has progressed dramatically, and therefore we more effectively can manage it.
Dr. Louis Kathan, it's been a pleasure talking to you. Thank you very, very much indeed for joining us on the program.
Thank you very much, Peter. Thank you for inviting me, and thank you, viewers.